all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart.
There is an Arab proverb that goes by, "He who has health has hope, and he who has hope has everything." Good evening. Welcome to another episode of BMC Global Life Al Hilal Health World, Nothing But Lifestyle. Winter can be a tough time for families with young children, as illnesses seem to spread like wildfire. Today, we'll be discussing about common illnesses that affect children in this season. And for that, to shed light upon this topic, we have Dr. Pragi Dingra, a specialized pediatrician from Al Hilal Hospital. Welcome to the show, doctor.
Hi. It's a pleasure to be here with you.
Thank you. When we look on the common illnesses that affect children, two illnesses often are topping up the list, and that is cough and cold. And it is often seen that it is frequently occurring in winters rather than summer. What do you think about it?
See, there are main two causes. One, when there is a winter, people tend to stay indoor more. When people cough, sneeze, their droplet is spread from the nose and from their mouth while coughing. It may spread on the tabletop, on the toys, or on even the doorknob when they are touching. So these are the area where the children get the infection. Suppose you have sneezed and your droplets have come on the table. The child has touched the same table, so the infection will come to the baby with that. Second main cause is there when we have winter, it weakens our immunity. So children immunity already it is very less. With the winter, the resistance becomes more down. So children tend to have more infection during the winter time.
Okay. And why do you think children are often subjected to these infections rather than adults?
Because children, their immunity is less. They're not like for adults. When we go outside, we tend to have lots of viral infection. So we get some immunity. But children, they've not gone to the school, especially the young children who are less than toddlers, less than 3 years old. So when they come in contact with any virus, new virus, their body responds with having more symptoms. And sometimes when we parents think, okay, this is okay, child may recover, but sometimes it may go to a bacterial one or more serious one. That time we have to be more precautious.
Okay. And how do you prevent this infection, doctor?
See, one of the most common thing is wash your hands properly. When you are washing the hands, you are removing the virus. So before handling your baby, especially if it's an infant, make sure your hand is washed. Secondly, use disposable tissues when you are having cough, cold, and throw it immediately. Don't keep it anywhere so baby can touch that. Third, vaccinations. So make sure your baby is vaccinated completely as per the schedule, because these vaccination will prevent the baby to have infection. Babies tend to have infection. You cannot prevent baby having cold and cough. Yeah. But yes, it will not go to a level that baby requires antibiotic or intervention from the doctor end.
Cold and cough are commonly found in the environment.
Yes.
So when is the right time for a person to visit the doctor?
See, if your baby is having temperature more than 38 degree for more than 2 days, if your baby is not eating well, you're feeling your baby is dehydrated, baby is sleepier more than usual, if the cough is more than 1 week, or you're feeling there's a rash on the baby body, please contact the doctor immediately.
A report suggests that bronchiolitis often occurs in children. Could you
Yes.
tell our viewers something about that?
Bronchiolitis is like inflammation of the airway which leads to the aeration or oxygenation of the lung. So whenever there is inflammation, it will cause the mucus buildup. When there is a mucus buildup, then it causes breathing difficulty. Usually it presents same like fever, cold, cough, but it may have hurried breathing. Your baby is breathing very fast, baby is not eating well, or you're feeling baby is very tired. So remember, there is a synonym like is FACT. F for if the baby is fast breathing, A for if baby is having acute distress, C for having cough, and T for temperature. If your small baby, especially premature born baby or baby having heart disease, lung disease, presenting with this symptom, please contact your doctor immediately.
Okay. Another virus that we come across is RSV. What
Yes.
is RSV, doctor?
See, RSV is like respiratory syncytial virus. It's a very common virus, especially during October to March. Like if I tell you statistically wise, around 2/3 of the baby born in less than 1 year have this virus. Normally it present as common cold, fever, throat pain, and it may have ear pain, and baby is very dull and lethargic. But it's like, as I told, it's a virus, it does not require any intervention unless if you're feeling the infection has gone to the lung, like child is having more hurried breathing, that time you have to contact the doctor immediately.
What is the treatment that is given to our children who are suffering from RSV?
Any virus does not have a treatment as such. First thing is prevention. Prevention is like, as I told, hand wash is one of the most common cause. This RSV virus most is commonly present in the children. So it is more in the nursery, play area, daycare area, or it may be in the school. So make sure if your child is having some infection, not to send them to school that time because it will infect the other kids. And if any adult is having any infection, make sure that they are covering their nose and mouth. They're washing their hands properly, vaccination as we discussed before, and if parents are smokers, we ask them to prevent smoking in front of the baby, especially if they're premature, because already their lung is already weakened, and this RSV can go very bad if the baby is again prone to more infections.
Okay. Most people are scared, including me, about the term pneumonia, as there is a high mortality rate associated with it.
Yes.
Could you give an explanation in simplest terms? What is pneumonia?
See, in the simplest term, pneumonia is infection of the lungs. Okay, so usually it may present like initially like cold, cough, fever, and baby is tired. But normally, if it's a virus infection, it will go down in 1 week or something. But if you're feeling the cough is worsening, child is having hurried breathing, child is having abdomen pain, this is like most of the parents don't know that it may also be a cause of pneumonia, or bloating of the stomach, not eating well, or you're feeling your child is more sleepier than usual. Like if your child usually before he was active, now you're feeling he wants to sleep all time. These are all signs of symptoms of pneumonia.
Yeah.
Okay, so normally pneumonia we can treat with a short course of antibiotic, but if it has gone worsen, then we may have to hospitalize the child and give antibiotic for 4 to 5 days.
Okay. Due to the changing weather patterns across Kingdom of Bahrain, there is a large number of cases of influenza as well.
Yes.
What is influenza?
Okay, influenza, like now it's very rapidly there in Bahrain. It's a very common virus. So the symptoms of influenza is high grade fever, especially in the evening time. Your child will be having shivering with a fever. Child is very tired, lazy, just lying down on the bed, not getting up, cold, cough, ear pain, throat pain, sometimes nausea, abdomen pain may also be present for the child. As such, viral infection is spreading from the crowd. Like now we had a new year, we had some function. So whenever we are going to crowded place, we are more prone to have infection. The treatment basically is hydration for it.
Doctor, we talked about bronchiolitis. What is bronchitis, acute bronchitis?
Okay.
These terms are very similar.
Yes.
Are both
Yes.
the same or are they different?
Bronchitis is different. Bronchitis is there. We have one like when we see the anatomy of our body, our lung has lots of small tubes, large tubes. Bronchitis, if one of your large tube is clogged with the inflammation, we call as bronchitis.
Okay.
So because of that, the child will have continuous cough. It will be starting like every minute your child is coughing, coughing, coughing. Initially it will be dry cough. The child will having like just a very raspy cough. After some time it may change to mucus producing cough. Along with that, the child may be having hurried breathing, child will be in distress, child will not be like restless, not sleeping at night. These are all common symptoms of bronchitis. Normally bronchitis does not require any treatment unless it's a bacterial. So if we have done a blood test and it's showing it's a bacterial infection, we can start with a short course of antibiotic or nebulization. These will help the child a lot.
Okay. You've also answered the next question what I had
Yes.
about the treatment.
Yes.
So we were discussing about the lung infections that affect children. Are there any other infections that children have during this winter season?
Now commonly what we are seeing, one is the winter stomach bug. Like as the name suggests, the child will have vomiting, stomach pain, diarrhea, fever, and not eating well. So 99% it's a viral case. We do not require any intervention apart from keep your child hydrated. If you keep the hydration, child will be okay in 2 or 3 days. But if it is going for some more bacterial infection, like if you're feeling there's a blood in the stool, or you're feeling he's passing mucus like stool, or your child is very much tired, then better to get evaluated whether it's some infection he has caught requiring antibiotic. Second, what we have seen nowadays in Bahrain is more of hand, foot, mouth disease. That's a viral infection. The child present, like it may be up till 5 years most commonly, with rashes on the hands, foot, also inside the mouth. Main presenting symptom will be fever for first 2 days, then child will be having rashes and not eating well. Again, as it's a virus infection, there's no requirement of any antibiotic, just we give symptomatic relief. Like we'll ask them to put some spray to reduce the pain for the baby, some just lotion to reduce the itching for the baby, and some antihistaminic so baby has a calm night and does not get disturbed at night.
Okay. Okay. In conclusion, what advice would you like to give to parents to prevent these infections for their children?
My advice for the parents is that all babies will have infection. Do not be worried about the infection. This is a source, like baby will fight and become more immunely strong. Okay, but do not use antibiotic for each and every episode of cold and cough. What we as a parents think, my child is sick, we should start antibiotic fast. This is wrong. Antibiotic is only to be used unless your doctor is telling or it's a life threatening. If it's a virus, it will take its own course for 1 week, baby will be okay. But don't cause this, because if you are using too much antibiotic for a child, the child will not respond to the antibiotic in later stage. He has his whole life ahead. Then we may have to go for IV antibiotic or a higher antibiotic, which will reduce the baby's immunity more. So stay safe, stay away from the crowd, vaccinate your child, hydrate your child will be okay.
All your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.